this is known as a Cuno meter. This is known as a Cuno meter. Even this also you can keep it in the initial stages with you. Everybody you can buy. It is a very super simple cheap product. So this is the plastic fiber, and this you can keep as a for the measurement is half chun, 1 chun, 1.5 chun and 2 chun. So till 2 chun you can measure with this appropriately. But the ancient people, they used to do this only for the anesthetic purpose. When we do the anesthesia that particular time, appropriate without any also doesn't get changes if we measure this. This also point detector is one procedure. The other procedure is the Cuno meter in the beginning stages. We try to find out. How to find out this? You can try this and you can learn this precisely now itself, so that you can buy it and then use it directly. Now I wanted to use only by using first is the 1 chun measurement we should select. One measurement we select, that automatically will select other measurements, right? Now how to do this Cuno meter? This is the plastic fiber and also has been fixed with the nut and bolt here. And then first we have to, this is folding 0. Now we wanted to use it as a 1 chun measurement. So for example, now the 1 chun is the maximum interphalangeal joint of the thumb to be known as a 1 chun, right? You just place it like this, where the maximum interphalangeal joint, you just fix it this. Now this is the 1 chun. I place it, this is as a 1 chun without changing anything. Now automatically this to be considered as a half chun, and this to be considered as a 1.5 chun, this to be considered as a 2 chun. Once you measure with this one thumb, otherwise you can measure from here to here. So from here to here you can measure from the 1 to 1. Now 1 chun I measured on the space in between the middle and then distal phalanges. Then now this to be considered as a half chun. That means this to be considered as a half chun, and this to be considered as a 1.5 chun. We can say this is 1.5 chun, and this to be considered as a 2 chun. This is 2 chun, this is 1 chun, right? This is 1.5 chun, this is half chun, and this is 2 chun. Right. Now how to measure? Now you have selected. This is for the, I am the patient for example. Now this is my fingers. If now somebody is there lying down on the patient on the bed, so you just measure for him. So this is how much. And then for example now P6 point is there. Pericardium 6 is day-to-day clinical practice we use for the nausea, vomiting, heart pain, chest pain and all. So we select from here to here. Yeah, this is the 2 chun. You keep it like this, from here to here 2 chun, and then point it. You just select the point and then insert the needle. Now for the fever, very good point is Sanjo 5. Sanjo 5 is the good point to treat for any kind of the temperature in generally if you use the multiple times, and then select the point. From here to here you just select, yeah, this is the 2 chun, and then apply the needle here. You can use it in this way also. You can use it by using the Cuno meter is more accurate, because you are measuring directly to the patient, not yourself. Right. So this also you can try. So how to do? Again I will show you. The procedure now is the 0. Right. Now I wanted to see. First we analyze with the whether you can select here. You can select on the interphalangeal joints in between. You can select from here. Yes. Now it is 1 chun. Now 1 chun I selected. This is half chun. This 1.5 chun. This is 2 chun. Right? So in this way you select this 1 chun or 2 chun, 1.5 chun, whatever the points you need to select, accordingly you can select by using the Cuno Meter. This also you can keep it in your home or at your center, right? You can buy it, hardly it is the minimum rupees. Now you understand different colors are there, but this is as shown, this is as a jimmy or applicator. This is the thumb pressure. This looks like a toy, but toys also can be given somebody to patient. This also works sometimes, is wonder. So when we wanted to give the pressure anywhere, right, you selected the point, for example P6 point, so we wanted to give the pressure, ask them to give the pressure by using the thumb pressure. Then fever is there, so due to temperature we can give the pressure in this region continuously and 2 to 3 minutes. By giving the thumb directly we will get pain sometimes. So now without pain how we can give the pressure? So by using the thumb toys. So this is as a acupressure pegs. This is acupressure peg which I told you. This also is the acupressure pegs. Now you can see this also sharp objects, this also sharp objects. Now this we can give as a pressure point we wanted to give. So we give here as a pressure. So give the pressure for 2 to 3 minutes here. Intermittently or constantly we can be given. So give the pressure and then activate. Give the pressure and then activate. For example, Li4 point is there. Especially for the headache is the good point. Generally is the general headache point, or the body pain is there. So you just give this peg to the patient and then ask them to give the pressure Li4 continuously every day, morning 3 minutes and evening 3 minutes. Any kind of the pain, not only headache, body pain is there, back pain is there, knee pain is there, cervical pain is there. So generally this acts as an analgesic point. But however it's the mild to moderate pain is there, that particular time this works well, and then you just give the pressure on the Li4 region and you just train them to the patient themselves. They can start doing this procedure, right? Whether giving by the thumb also recommended, like this giving the pressure also good, by giving the pressure like this also good, or by giving with the acupressure applicator, this also good, right? So we keep giving the pressure with intention. Somewhere is without intention they are doing is not good. With intention we keep giving the pressure on this region is always is clockwise direction and anti-clockwise direction, and giving the pressure to that particular region for few minutes, right? First is giving the pressure, then clockwise direction for a minute, anti-clockwise direction for a minute. The same procedure to be continued for several minutes, like 3 minutes, 4 minutes, 5 minutes maximum can be given, but bilaterally to be good. Give the both the sides is always is good, right?